Another activity that is currently taking place across the country is the mass testing to establish the status of the pandemic. And to understand this better, I'm joined by Dr. Sabin Nsanzimana via phone. Good evening, Dr. Sabin.
Good evening, Gloria.
So today is day 2 of testing, and beyond just the establishing of the status of the pandemic in the country, what are you expecting to find? And after the 10-day lockdown, and how will this inform the next steps?
Thank you very much. Indeed, we are conducting massive testing in the city of Kigali up to the cell level. So we're targeting 15% of the adult people living in all cells in the city of Kigali. This is the largest sample size we've ever taken in massive testing in the city of Kigali. So the main objectives are actually to understand better the spread of this virus in the population of the capital of Rwanda. But also we are setting up a baseline from which we will repeat the same testing 10 days after during this lockdown that we just started, so we can measure before lockdown where were we and what the impact of these measures and also understanding which areas are most affected, so additional measures also can be implemented, including also finding those who are probably very sick and don't know. So these the 2 days that we had actually completed few hours ago, and our target has been achieved in terms of numbers of people to be tested.
Absolutely. Could you also tell us about the correlation of the high numbers, such as the ones that we saw yesterday, of positive cases, together? That, of course, it goes hand in hand with the number of tests conducted and then the low positivity rate.
Yeah, actually, in epidemiology, you always want to test as many people as possible. So yesterday was the highest number of people we've ever tested since the COVID-19 pandemic started. And we identified also the highest number of positives. Of course, since the denominator has increased significantly, the positivity went down. So this is the ideal way of managing the pandemic, testing more people and trying to find the positives as quick as possible before they spread without even knowing. So today we expect the same, because we also conducted a big number of tests across the city of Kigali. So we expect also the number of positives to be high, and positivity going down as you test more is a normal trend expected. And all these thousands of positives that are being found in these 2 days are going to be managed in a way that they don't actually create new clusters of infections. This is the main benefits of conducting massive tests. And as we said, it's not going to stop here in Kigali only, because it will go also in the other districts starting from next week.
And with the increase of numbers of positive cases, would you say that the 10 days of lockdown will change anything in terms of the spread of the virus? And what are the plans if it doesn't? Well,
10 days is already a good number of days to make an impact in the spread of pandemic. Of course, during these 10 days, what we will do is more important than just being into lockdown, because we know that transmission comes from people to people. So the less movements are out there, the less risks of transmissions. And the more days we can reduce these movements. Of course, we understand the other consequences of that needs to be looked at. But we have hope that these 2 days are going to make a significant impact in the COVID spread that we observed the last few weeks. And as I said, after 10 days, we will repeat the same mass testing, so we see what we had before and what we have now. And that can also inform other further decisions that could be made now based on strong data and a large sample size that we're taking mainly in the city of Kigali.
I would also like to take this chance, Dr. Sabe, to ask you about the COVID-19 therapeutics that we're using in Rwanda for the COVID-19 patients. I think a while ago we were using the favipiravir, but do we have any new advancements at the moment?
Yeah, absolutely. The therapeutics to COVID-19 are also improving, although we don't have treatments that stopping the last phase. I mean, the advanced stages of this disease, usually known as cytokine storm, where our own immune system is part of the severity of the disease. But the earlier you initiate treatments, the better. So we have some antivirals. You mentioned the favipiravir is a good drug we've used since last year, and it has shown very good results to cut the risks to severity of the disease. We're also using ivermectin, which is also showing some good results. We also have other types of combinations. As you know, the virus generally do not have medications that will easily cure it. So we try also to help the immunity to fight itself. And there are other support that needs for our own immune system, including nutritional support that not necessarily are drugs, but helps our own system to fight back. Sometimes the risks can go up to further infections that need to be also treated. There are also monoclonal antibodies that are quite helpful. We're trying to acquire more of these so that we can have a cocktail of drugs that will help to prevent the stage that I mentioned, which is unfortunately sometimes when someone has reached that stage of storm, it is not easy to manage. And oxygen therapy is also very key.
Yes.
This has been upgraded recently, and almost in all provinces now, the capacity is increased, so that we continue to prepare ourselves for cases that may increase, or also for the earlier management has been always the best. That's why we urge people to, whenever you have symptoms, go for a test and receive these drugs that we have. We help to not go to the oxygen or to ventilators later on.
Certainly. As we wrap this up, Dr. Sabe, 18 or so months later since this public health crisis, I think one could say that some people have lost momentum in terms of fighting the virus, hence why we're seeing people deliberately going against the set guidelines. But how big of a threat is this, and what's your message?
Yeah, the COVID pandemic, when it started, no one thought really it would last so long, and no one can tell when COVID is going to end. But I believe that with the availability of vaccines and advanced treatments, we'll be able to overcome this pandemic if we continue to actually push a bit forward and not get infected or get affected, because this virus is changing itself so rapidly and so differently, and sometimes the new the new variants that are coming are more severe than the virus we had last year. That's why measures that individuals should apply themselves, their families, to the workplace and where they go, must go also in the same speed, in the same line that the virus itself is changing. Unfortunately, we see some people getting some kind of fatigue. That's why we urge everyone that this fatigue is not in our favor. It's actually going to be in the favor of the virus. The virus will be able to take more lives and also affect more people. That's why maybe a couple of months to push until we get more vaccines and also be able to be in advance to the virus. Otherwise, we'll be still struggling behind if we don't take these measures very seriously.
Absolutely. Dr. Sabin Nsanzimana, thank you so much for making the time to speak to us this evening.
Thank you for having me.
Bye. Have a good evening.
Bye.